When the first gunshot echoed from the gang shootout, Dr. Sofia Alvarez was checking 5-year-old Diego's ear infection at the Rivera Community Health Center in South Chicago. As the crossfire erupted, everyone dropped to the ground. But Sofia did something unexpected. She flung the clinic doors wide open. "Dr. Alvarez, it's too dangerous. We should lock the doors," shouted Nurse Carla, her voice trembling with fear. But Sofia was already sprinting into the street. Over the next 6 hours, the neighborhood would discover who Dr. Sofia Alvarez truly was, because the sound of gunfire and the scent of blood were not unfamiliar to her. When the gang violence subsided, Sofia had brought 7 injured civilians into the clinic. But something had shifted. Something was profoundly different. Sofia's demeanor had transformed. Her movements, her speech, it was as if she had become an entirely different person. Welcome to Hidden Heroes. Before we dive deeper into this gripping tale, share in the comments what city you're reading from today. And if you believe stories like this deserve to be shared, please give this a like and follow for more. Dr. Sofia Alvarez was a 38-year-old family physician at the Rivera Community Health Center in South Chicago. For 6 years, she had served this tight-knit community, earning their trust and affection. She hummed lullabies in Spanish while treating young patients, listened patiently to the elderly, and built genuine bonds with families. "Dr. Sofia is our guardian angel," the locals would say. "Always here, always ready to help." But Sofia's readiness stemmed from a past far beyond the typical community doctor's experience. Her routine at the clinic was predictable, arriving at 7 a.m., leaving at 6:30 p.m., and seeing 35 to 45 patients daily. From flu shots to diabetes management, prenatal care to geriatrics, she handled it all. Yet Sofia's medical expertise was rooted in far deeper waters. Nurse Carla often remarked on Sofia's unique approach to emergencies. "Sofia, how do you stay so calm with trauma cases?" she'd ask. "Experience," Sofia would reply softly. "Sometimes life throws you into tough spots." That experience came from a decade with Doctors Without Borders. From Yemen to the Democratic Republic of Congo, from war-torn regions to disaster zones, Sofia had practiced medicine in some of the world's most perilous environments. Dr. Sofia Alvarez's true story began 14 years earlier. After graduating from Northwestern University's medical school, she completed a residency in emergency medicine, but her ambitions set her apart. She craved humanitarian work. "Why choose dangerous places over a cushy career?" her mentor, Dr. Patel, had asked. "Because I belong where the need is greatest," Sofia had answered. Medicine isn't just for sterile offices. When she joined Doctors Without Borders, she underwent rigorous training: international emergency medicine, conflict zone trauma care, mass casualty response, and surgery with minimal resources. Her first mission was in a Yemen refugee camp, treating war injuries, malnutrition, and infectious diseases. Over 20 months, she cared for over 2,500 patients and assisted in 500 emergency surgeries. Her second assignment took her to the Congo, where she faced militia attacks, bomb injuries, and civilian trauma. There, she honed skills in advanced trauma surgery, managing gunshot wounds, shrapnel injuries, and blast trauma with military precision. Her third mission was in Haiti, post-earthquake. Amid collapsed infrastructure and cholera outbreaks, Sofia handled mass casualty events with scarce supplies. Those years forged her into more than a doctor. She became a field surgeon, a crisis manager, a beacon of hope in chaos. Sofia's Doctors Without Borders training wasn't just medical. It was war surgery, emergency trauma care, and resource management under extreme conditions, skills that set her apart. "A doctor in a conflict zone must be more than a doctor," her field supervisor, Dr. Khan, had said. Dr. Sofia Alvarez thrived in chaos. Limited resources, relentless pressure, life and death decisions every minute, this was her element. She called it MacGyver medicine, achieving maximum results with minimal tools, stitching wounds under gunfire, performing surgery during blackouts, and triaging patients amid explosions. Her toughest training was in mass casualty triage, marketplace bombings, suicide attacks, school strikes. Sofia had learned to manage 30 to 40 wounded civilians at once. One day in the Congo, after a militia rocket attack, over 70 civilian casualties flooded the field hospital. Sofia operated for 16 hours straight, saving 52 lives. That day, her medical prowess reached its zenith. But after a decade in conflict zones, the toll emerged: nightmares, panic attacks, hypervigilance, PTSD symptoms. She decided to shift to civilian practice. Why leave the front lines? Her Doctors Without Borders coordinator, Dr. Mendez, had asked. Because I want to serve vulnerable communities in peace now, without war, Sofia replied. When she joined the Rivera Community Health Center in South Chicago, Sofia was vastly overqualified. Her international emergency medicine expertise, trauma surgery skills, and conflict zone management were unparalleled, but the hiring committee didn't probe deeply. I want to focus on community medicine, serving underserved populations, Sofia had said simply. Her daily routine felt almost tranquil compared to Yemen. Pediatric exams, chronic illness care, family health, she handled it all with ease. Yet Sofia approached every case with a conflict zone mindset. Workplace injuries, overdoses, domestic violence cases, she applied her Doctors Without Borders triage skills instinctively. On Saturday, August 15th, Sofia was on her usual shift at the clinic. 8 patients were present: Diego's ear infection, Mrs. Lopez's hypertension check, a teen's asthma consultation. At 2:45 p.m., the first gunshots rang out, sharp, distant, unmistakable. Automatic weapons, multiple shooters. Sofia's military training snapped into focus. "Carla, what's going on outside?" asked Diego's mother, Elena, her voice shaking. "Gang activity," Nurse Carla replied, nervous. "Probably a drive-by. It'll pass." But Sofia was analyzing the sounds. Multiple AR-15s, sustained bursts, coordinated patterns. This wasn't a drive-by, it was a full-scale gang war. Chaos erupted outside, a turf battle between the Vipers and the Iron Hands over a drug corner. 20-plus armed gang members, automatic weapons, open combat in a civilian area. Inside the clinic, panic took hold. Patients dropped to the floor, faces etched with terror, moving away from windows. "Everyone stay down," Carla ordered. "Stay away from the windows." But Sofia was different. She was calculating gunfire patterns, potential civilian casualties, medical response strategy. The shooting lasted 12 minutes, then silence. The gangs had retreated, but the aftermath began: screams, cries for help, voices pleading. "Someone's shot. Call 911. Sofia peered out the window. 7 wounded civilians lay in the street, gunshot wounds, shrapnel injuries, bleeding profusely. "Carla, did you call 911? "Yes, but ambulances are 25 minutes out. Police are securing the area first." 25 minutes was too long. Sofia assessed the wounded: critical bleeding, potential organ damage, shock setting in. Some wouldn't survive the wait. Decision time: stay safe in the clinic or enter the danger zone to save lives. "Carla, prep all treatment rooms," Sofia said. "Sofia, what are you doing?" "Opening the doors. Bringing the wounded inside. It's too dangerous. The gangs could return." Sofia paused, weighing risks: gang retaliation versus civilian mortality. Her training took over. "Carla, ready for fluids, trauma kits, surgical tools. Now." Sofia unlocked the door and stepped into the street. After a decade, she was back in a conflict zone, hand steady, mind razor-sharp, mission-driven. She began triage on the street, her military field medicine instincts automatic. Casualty 1, 50-year-old man, gunshot to thigh, conscious, moderate bleeding. Casualty 2, 28-year-old woman, shrapnel in leg, stable but shaken. Casualty 3, teenage girl, gunshot to chest, critical. Casualty 4, elderly woman, stroke induced by stress, unresponsive. Casualty 5, young father, gunshot to arm, heavy bleeding. Casualty 6, 9-year-old boy, shrapnel wounds, sobbing. Casualty 7, middle-aged woman, blunt trauma from fleeing, disoriented. Sofia worked methodically. Critical cases first, stabilize, transport. Sir, can you walk to the clinic? Ma'am, apply pressure here. Follow me. This girl needs a stretcher, critical. Carla was stunned. Sofia had organized 7 wounded civilians, bringing them into the clinic. Treatment rooms, hallways, even the reception area became a field hospital. Sofia, we're not equipped for this. This is ER-level trauma. We adapt. Triage principles, critical cases first. Sofia prioritized the teenage girl with the chest wound. She established 4-access, controlled bleeding, and prevented shock, using field surgery techniques from the Congo. Carla, prep surgical tools. I need to explore this wound. Sofia, we can't do surgery here, no sterile conditions. I've done surgery in jungle tents. This is fine. Sofia's hands moved with surgical precision, wound exploration, bullet fragment removal, lung stabilization, hemorrhage control. Over the next 5 hours, she performed miracles. Chest surgery, shrapnel extraction, vascular repair, stroke stabilization, medication protocols, wound debridement, infection prevention, pediatric trauma care, and psychological support for the boy. Carla watched in awe. This wasn't a family doctor's skill set, this was a trauma surgeon's. Sofia, your technique, where did you learn this? Sofia paused, revealing a decade-long secret. Doctors Without Borders. 10 years. Yemen, Congo, Haiti. Carla's jaw dropped. You were a Warzone doctor? A combat medic? Trauma surgeon? It wasn't relevant until today. Carla realized Sofia's true caliber. This woman had saved thousands in crisis zones. The gang shootout was just another mission for her. When ambulances arrived, paramedics expected chaos but found an organized trauma unit. Ma'am, status report? Sofia delivered a crisp briefing, 7 casualties, all stabilized. 1 thoracic surgery complete, stroke patient stable, gunshot wounds treated, pediatric trauma managed, ready for transfer. The lead paramedic was floored. This is incredible. Your background? International emergency medicine. Conflict zones. At the hospital, ER staff were stunned by Sofia's field care. Who did this surgery? A nurse asked. Community clinic doctor, Dr. Alvarez. Community clinic? This is trauma center quality. Sofia followed up at the hospital. All 7 patients survived, thanks to her swift, expert intervention. Dr. Reynolds, the trauma chief at the hospital, approached Sofia. Dr. Alvarez, your emergency response was exceptional. Where did you train? Doctors Without Borders, Conflict Zone Medicine, Sofia replied. MSF? You're a humanitarian doctor. Why a community clinic? Service takes different forms, Sofia said. This is my mission now. Word spread like wildfire through South Chicago. The community learned of Dr. Sofia's hidden past. Our clinic doctor saved 7 lives during the gang shootout. International humanitarian surgeon serving South Chicago. Warzone medic hiding in our neighborhood clinic. A community gathering was held, families of the survivors, local residents, and neighborhood leaders came together. Dr. Sofia, we had no idea about your past, said Elena, Diego's mother. Why keep it a secret? Because service is service, Sofia answered. Warzone or clinic, the goal is the same, help people. You risked your life for strangers, Elena said, tears in her eyes. No strangers here, Sofia replied. This is my community. Sofia's former Doctors Without Borders colleagues caught wind of the news. The global humanitarian medical community praised her response. The MSF regional director called her. Sofia, we heard about the shooting. Classic MSF instincts in a civilian crisis. Your training never fades. Would you consider returning to the field? We need trauma surgeons like you. Sofia paused, reflective. My service is here now. This community needs me. Understood, the director said. But the field is always open for someone like you. In quiet evenings, Sofia reflected on her career shift. Did I make the right choice leaving field work? 10 years with MSF versus 6 years at the clinic, different arenas, same mission. In Yemen, she had treated thousands under fire. In South Chicago, she treated thousands more, managing chronic illnesses and emergencies with equal care. War zones demanded life-or-death decisions. The clinic required decisions for quality of life. Service, she realized, never stops, it evolves. Her PTSD symptoms had eased with community work. The steady rhythm of clinic life healed the scars of war zone trauma. Sofia's story wasn't just about heroism, it was about applying expertise across contexts, the continuous transformation of service. MSF taught her emergency medicine, South Chicago taught her preventive care. Both were vital. Survivors of the shootout, seeing Sofia at the clinic, would say, true doctors never stop healing. They just find new ways to do it. Her courage that day was a civilian echo of her conflict zone experience, international medical expertise applied to a neighborhood crisis. I'm no longer a war zone doctor, Sofia said, but the healing spirit never fades. Service continues, only the place changes. The community began to see it too. Service takes many forms. So we ask you, have you encountered humanitarian workers quietly serving in your own community? Hidden global expertise contributing to local care? Share in the comments, because at Hidden Heroes, we believe the greatest healers often work in the most unexpected places. If this story inspired you, share it, follow for more, and help these vital humanitarian stories spread. We'll see you in the next hero's tale. And remember, the next time you meet a community doctor, nurse, or local medic, they might carry a wealth of international experience you'd never suspect. True healers adapt their service, but their healing spirit endures.